Holton, and I work in the Travelers Health branch at the Centers for Disease Control and Prevention, or the CDC in Atlanta. I'm delighted to be here today. It's my first MedX. I'm really excited to see all the good work everybody's doing. So in Travelers Health, I specifically lead all of our communication, education, and outreach activities. And I'll be talking to you about some of the changes in the conversation around travel that we would like to help implement in the coming days. So I'd like you to think back for a minute to the last time you went to the doctor or even the hospital and what sorts of topics you discussed with your doctor or the nurses there. I know you were asked to fill out forms about your family health history, your own health history, maybe your diet and exercise patterns, drinking and drug use. I've even been asked about sunscreen because I'm really pale and about whether or not I wear a seatbelt. But what about travel? Has anybody ever been asked about your travel history or your travel plans? You have? Oh, that's great. Very good. Very good. Well, I have. I want to share a couple of personal stories about that. So I went to the doctor on October 13th, 2014 with 103-degree fever. That was 5 days after Thomas Eric Duncan, the first person to be diagnosed with Ebola in the United States, had died in a Dallas hospital after arriving in the United States from Liberia. So when they took that thermometer out of my mouth, the first question I got was, have you been in Liberia? Because 103 was the magical number in CDC's Ebola guidance. So, you know, I knew what they were getting at because I had been working on our Ebola emergency response since July, and in fact hadn't been anywhere really except my house and the Emergency Operations Center at CDC. But it took a little while to get away from that idea. And the fact is that asking me if I've been in Liberia wasn't really a very complete question. There were Ebola outbreaks going on in several countries in West Africa at that time. They didn't ask me about that. And they didn't ask me about other travel. So, you know, a lot more people in the US travel to the Caribbean every year than to West Africa. And there was a big chikungunya outbreak going on in the Caribbean then, which also can result in a high fever. So they didn't really get at that travel question. So it turned out I had a really routine case of pneumonia, but nothing exotic. But then later that year, I was making an appointment on the phone for just a routine checkup. And the receptionist said, well, I have to ask you something weird before we hang up. I said, okay, what is that? She said, have you been in the Middle East, South Korea, or West Africa? So there she was trying to get at, had I been exposed to MERS? Had I been exposed to Ebola? And I think there, again, the question's not complete. It stigmatizes travel to those countries and doesn't offer my healthcare provider a really full picture of what my travel life looks like. So you might be wondering if travel's really that important when it comes to the health conversation. But 73.4 million trips were taken outside the United States by US residents in 2015. And that number's only growing. And this is only the US piece of that picture, and global travel, especially from developing countries, is increasing exponentially. And this is a picture. It might be a little bit hard to see because it's bright in here, but this is a picture of what 1 day's worth of international travel routes looks like. So you can imagine the number of people and goods that are moving around the world every single day. And it makes it pretty obvious that an infectious disease outbreak is a plane ride away. So some travel-related diseases have been making the headlines. Ebola, Lindsay Lohan got chikungunya on a trip to French Polynesia a couple of years ago. MERS, you probably remember a couple of years ago when MERS was in the news. And now, of course, Zika. These headlines give a part of the story, but I don't know that they give the whole story, the personal story about travel-related diseases. And I work at CDC, so often my work is really removed from the personal stories too. But I had the opportunity to talk with some travelers and some doctors and get some stories that really, I think, bring home the importance of understanding travel health. One of those that's really stuck with me was we're doing a project in New York and New Jersey, and I was talking to a physician at a hospital in New Jersey who told me that every year she serves mostly an Asian Indian population in her area, and every year they have the back-to-school malaria cases because people go home over the summer to India, don't realize they're vulnerable to malaria, come home sick. In this case, there was a 4-year-old child with malaria, and the parent said to her, "Why didn't my doctor tell me about this? Why didn't they tell us there was something we could do to protect our little girl?" But even last week, I was traveling and talked to a friend of a friend who's making pregnancy plans and also travel plans. And so Zika comes into that picture as she's looking at travel around Southeast Asia. So these headlines impact people's daily lives in very real ways. So the stories I'm telling you are some examples of why we want to make travel part of the routine health conversation, but also why we want to make health part of the travel conversation, so that you know when you're booking travel, there might be things you need to think about your health. So I'm going to talk some today about our plans for increased outreach to both clinicians and travelers in the travel industry, and how we want to do education in these areas. And you can really help influence those plans with your ideas and your experiences. So I'd invite you to use our hashtag ThinkTravel if you'd like to share any of those ideas. So at the Travelers Health Branch, our mission is to help reduce illness and injury among U.S. residents traveling and living abroad. We do have an expat audience, but really our recommendations and our mission goes beyond U.S. residents, and we have a global mission as well. And we try to use the best available science to make all of our recommendations. So I want to show you a little bit about the website that we have, but I'm going to go online to do that. So this is the Travelers Health website. It's cdc.gov/travel. It should be pretty easy to remember. In the left navigation, we have a lot of information for you, quick links to things. But the real heart of our website is certainly our destination pages. We have travel-related information, health-related information for every country in the world, along with a few places that aren't countries, but that are distinct from their parent country. So you can either select information for travelers or for clinicians. I'll show you both of those. We also maintain travel health notices. So we're monitoring outbreaks and events around the world that might not be part of the routine risks in a particular destination and posting notices about those. Right now, we are inundated with Zika notices. I think there's something like 57 of those with active outbreaks, but there are other things going on as well. We rarely recommend against travel to any location. That's only in the most severe circumstances, and really our mission is to promote healthy travel, not to scare people away from traveling. And then we also do have a large section of our website that's devoted to especially clinician updates, new research, new recommendations that are coming out. So we'll just select somewhere. Don't we go to the Bahamas? Now, I can also look and see if I'm one of these, what we call special populations. So, for example, if I'm somebody who has a chronic disease, like heart disease or something like that, there's some special recommendations. Or if you're visiting friends and family, often that comes with some increased risk of travel-related diseases. So you can get some special information. Then on our page, everybody wants to know about vaccines first and foremost. So we offer that, the vaccine recommendations that most travelers need and that you might need in particular situations, along with a lot of information about behaviors you can take to stay healthy when you're traveling, because really vaccines are a small part of the picture. So food and water recommendations, insect bite, animal recommendations, and then some things like knowing how to get medical care in the country that you're going to, or selecting safe transportation. For example, I was just in Indonesia last week, and Jakarta has some bad traffic. I thought Atlanta had bad traffic until I went to Jakarta, and I got in a cab that didn't have seat belts in the back seat, and I made him let me out, and I got another cab. So you really have to be aware of those recommendations and be prepared to stand up for yourself. We also have some information about how to make sure you have a health kit that you have in your suitcase with products that you trust. All of our travel health notices that apply to a particular destination will show up. And some information about what to do if you get sick after your trip. So for any country, sorry, I can't see where I'm going very well. You can always switch over to the clinician view, which has very similar information, but just in a format that's more conducive to patient-physician interactions, and gives some information to help prepare travelers and also to diagnose returning ill travelers. Let me just go back. So in addition to our website, we have some mobile apps that we've developed to try to make it easier for people to follow our recommendations. These are really practical in nature. TravWell, the first one, is a planning tool. You can create a trip with your destination. It will give you some limited vaccine recommendations, let you set reminders for vaccine, build a vaccine history, set daily reminders for things you might need to do during your trip, like to reapply bug spray every few hours or to take your malaria medicine on the right schedule. Also a customizable health kit packing list and a space for your documents, maybe a copy of your eyeglass prescription in case they get broken, something like that. And then Can I Eat This is an app that works completely offline once you've downloaded it. You tell it where you are, answer a few questions about what you're about to put in your mouth, and it'll tell you if it's a good idea to do that or not. So if you don't have a data plan, you don't have Wi-Fi, and you can't remember the food and water recommendations, you can still help protect yourself. These are both free. They're available on the Google Play Store and the App Store. And we have a spot in the Tech Hub where you can play with these apps. We're happy to demonstrate them and let you take them for a test run. We're also on social media. So you can find us at CDC Travelers Health on Facebook and at CDC Travel on Twitter. We are looking at some new social media channels, so stay tuned for that. So, at CDC, we are obligated to write out all the guidance, but we also try to put things in a more interesting and memorable format. So we do a lot of infographics. These are two of the most popular ones, the International Road Safety. And like I said before, everybody's thinking about vaccines, but in fact, motor vehicle crashes are the #1 killer of healthy U.S. residents who are traveling abroad every year. So road safety is a huge concern. In fact, during the Olympics, there was an Australian coach who was killed in a car accident, and it happens all the time. And then there again is another way to get a good idea of what's safe to eat and what's not. We have copies of these and other infographics at the Tech Hub too, and they're downloadable on our website. We do have a lot of resources, especially for clinicians. I already mentioned the website. We also publish a book. We call it the Yellow Book. It has a long, unwieldy title, but the Yellow Book. And it comes out every 2 years. It's the gold standard medical reference text used throughout the world. And actually, in 2 weeks, we'll turn in the manuscript for the next book. We've been hard at work on it. But this 2016 book is out now, and we have it at our spot at the Tech Hub. Welcome to come look at it. It's available in hard copy, online, as an ebook, and an app. And then we offer clinician education that comes with free continuing medical education for doctors, nurses, pharmacists, and health educators. And so the way forward, we've done a lot to set the stage, but in the last few years, we've been in constant emergency response mode because of outbreaks that have to do with travel. So MERS, H7N9, Ebola, Zika, and we don't know what's coming next, but we know we want to be prepared for whatever comes next. And not just that we want to be prepared, but we want to help travelers and their clinicians be prepared. So we're really looking at how to educate clinicians, especially people who don't practice travel medicine every day as their main job or their main specialty. Because most of us aren't seeking out specialized care for travel. we're going to our primary care providers, and it needs to be part of that routine care. So we're looking at how, like I said, how to make travel part of our routine health conversation. One of the ways that we're looking to do that is through a comprehensive travel medicine curriculum for non-expert providers. So we're in the developmental stages of that, and we'll be looking to clinicians around the country to help us understand their needs for education and what topics will help them provide really good care for people who are traveling internationally. And that includes travel preparation, as well as the ability to diagnose ill travelers or to refer them when necessary. But we also are in the very formative stages of a communications campaign to clinicians to try to encourage them to talk about travel with patients. And so, you know, it's really not just small talk to ask your patients about their travel plans or their travel history. So that's another thing that we're certainly looking for input and advice to make sure that this works in the real world. But in the meantime, we definitely want people to keep on traveling, and we hope you'll help us make travel part of the health conversation. I've gone over a lot of our online tools. I encourage you to use those and to connect with us online. We really want to hear your stories and hear from you about how we can improve the work we're doing. So just once again, we're at CDC Travel, and Facebook at CDC Travelers Health, and we do have an email subscription service, but it's just hard to use. So if you want to sign up for that, please stop by the Tech Hub and we'll just help you. It's way easier. All right, thank you so much.
Chief Medical Officer at United Health, who spoke on Thursday at the Healthcare Innovation Summit here. And what she spoke about, she is the global Chief Medical Officer. She manages a lot of the the travel of a lot of expatriates in the area. And what she talked about was healthcare insecurity. And what's happening is a lot of people, they go to countries and then they get an ear infection, they get a fever, and they fly completely out of that country to another country to get their care. So my question is, what has been your experience with patients who have made decisions, have read your manual, who've made a decision that, hey, this may be something that, you know, I don't know how to handle. The manual says, hey, listen, this could be something. How might the CDC work with, you know, local agencies to facilitate a more, first of all, less expensive, but probably more practical way for people to manage travel when they go abroad?
So you mean people who have traveled somewhere else and are coming back to the U.S., or people who are traveling in the U.S. from other places?
People who are coming from the U.S. or even live somewhere else, or they may be working in another country. They are from the U.S., they go to another country, they get sick in that country.
Right.
And they're making a decision to either come back to the United States or go somewhere else rather than manage their illness within the country.
Right. So that's a really important thing to think about before travel and to have a plan in place. One of the things that we recommend that people do is really research the healthcare system and the place they're going. There are a lot of countries around the world where you can get perfectly adequate medical care, but there are some countries where you can't. And one of the things that we recommend to every traveler is to check your health insurance coverage abroad before you leave. Find out if the policy that you have offers you any coverage at all. Mine does, for example, but I have to be prepared to pay out of pocket and then get reimbursed when I come home. But then also think about medical evacuation. If you are in a situation where you need to get out to get good care, that can be an incredibly expensive proposition. It can cost anywhere from $25,000 to $1 million. Now, the embassy in the country where you are will help you get out, and they'll even advance you the money, but it is a loan that has to be repaid. So you don't expect the U.S. government to take care of your health care. And so I was just on a trip. I bought a supplemental medical insurance policy and a medical evacuation policy. It also covered all of my trip expenses for cancellation. It cost $33. It is not a big investment, but it's a huge investment in your peace of mind. I'm thankful I've never had to use my medical evacuation insurance, but it really can happen anytime. I mean, I was on a cruise once, and a woman fell down the stairs of the jacuzzi, had a compound fracture in her leg, and had to be helicoptered away from the ship. So that might be a situation where people aren't thinking that they really have a lot of need for medical evacuation insurance. But also in some countries, for example, if you get bitten by an animal, you have to be treated for rabies. And there are countries that don't have RIG available and that don't have rabies vaccine available, and you have to get out immediately in order to get that treatment. So when you're looking at those policies, you have to make a decision. Do you want a policy that will get you to the nearest adequate hospital, or do you want to be evacuated home? So there are a lot of choices about that, but it's a really, really important part of planning your travel. And when you think about what you invest in a trip, it's a really small thing to make sure you're insured.
Oops, sorry.
Yeah, we definitely have, and we've had some limited inroads with that. A lot of times the travel industry is a little bit reluctant to partner with us because they're worried that people will be deterred from traveling if they understand the health risks. So we are really making a big effort, and have over the past few years, to show that we're promoting travel, but promoting healthy travel, and that people who stay healthy on their trip are more likely to take the next one because they have good memories. So I hope that's something we'll be able to continue to do in the future. We do. I mean, we sometimes are able to post ads on Expedia and other travel sites. That's not something we've been able to regularly fund, but in certain situations.
Sorry, we're just getting, we actually have our other speaker here, Shaitan Sarabu, who has his presentation ready. So we're going to continue with a few more questions, and then we'll have him speak.
Our real mission is focused on international travel from the U.S., but there are other parts of CDC certainly who are looking at more domestic risks, and sometimes, especially with Zika and outbreaks and things like that, we will get involved in domestic travel. But I think your experience with the travel industry is certainly the same one we've had when we're thinking about international travel, is that there's a reluctance to let people know up front what the risks are. I think it makes a lot more sense for people to know the risks and be prepared and not suffer those consequences.
I have a question. This is actually for both of you. So we're talking about topics that it's not top of mind for most people, right? In your case, you're dealing with people who obviously don't always get to the front of the line in terms of their needs, their priorities. And you are dealing with Americans who don't really think about these what ifs until they get into another country. So these aren't things that people are thinking about every day. Nonetheless, there have been many opportunities for you to make these things better. Can you just kind of briefly tell people how did you get some of these things that aren't typically top of mind to people who could make decisions and help support your efforts?
First, because everyone's looking at me, so I think that means I go first.
Doesn't matter. No
Great. Okay, so I'm going to answer this a little bit maybe differently than I think you're thinking I'm going to do. So I'm Canadian, despite the accent, not American, sorry guys. But I worked in the National Health Service for a number of years, and one of the things that the NHS has that Canada doesn't have, even though it also has a single-payer health system, and certainly the US doesn't have because that's a completely different health system, is we have one online asset. So you go to nhs.uk, and it's the voice of the health system online. What's incredible about it is you have 80,000 pages of clinically assured content. So there's no advertising. This is clinician signed off. Everything is written. There's no advertisement at all. You don't have pop-ups. It's straight up health information on everything. Now, why I think this is really important and how it answers your question is that what we know now about consumer behavior in health is that the first thing somebody does when they have a problem is they Google it. They do it in the car, they do it on the couch at home, they do it while they're watching like The Bachelorette and she says she has like some condition and you've never heard of it, so you start Googling even though the TV is on. You do it standing at the bus stop, everybody's doing it. What's happened in the UK is with 80,000 pages of wicked content, we get all the traffic. So you Google something and the first result you get almost always is the health system. So now we have this consumer behavior where they Google and they end up on our website and you get the voice of the health service. So that means that if we want to talk about something, if something's top of mind, or if we want to be clever and start pairing their search with something that they should know, maybe they didn't ask for it, but we want to push it towards them, we're able to do that because we own that digital asset. So for instance, if someone's looking at like pre-trip travel for children, that's probably one of our 80,000 pages, I bet it is, then you could spam them or you could surface content that's like, oh, are you going to any of these countries? This is now a priority. Or if you looked up ski trips to Colorado or like common, things you should do before a ski trip, this is an opportunity for the health system to then say, by the way, you should consider things like altitude before you go on holiday. So it's frustrating as a Canadian because you see how well it works in the UK and what a huge investment it is, like financially, but also how smart it is to set that up, given the way people work online nowadays. In Canada, we're not doing it. In the UK, I know in the US, I know there are services that are similar, but because they're fragmented, there's more than one supplier of online health information in the US. I won't throw anyone under the bus, but I know people have strong views on those particular suppliers. It means that you're just not going to have that same user journey, and I think it's a real shame. So to answer your question, like the way in which I would do it is I think all governments need to think about, like, it's a tremendous issue for us. We need to prioritize this. It actually doesn't cost much money to make these digital assets online, and the impact is so huge. Our ability to then connect people and get clever about, if someone searches for one thing, if they're, if we know that they looked at smoking cessation, then pregnancy content, we can then make an assessment about a pregnant woman smoking and then spam her, but with good, like, pro-healthy information that's going to sway her health decisions. So this is sort of the solution that I see to this problem, because if not, what you're doing is having to really struggle and do all sorts of different communications campaigns to get through the noise, and people aren't always responsive to that. It's also incredibly expensive to do, like some of this TV advertising, print advertising, getting all the doctors trained up to do all this. One way to completely bypass that is just have a really strong digital asset, which of course would be my answer because I just talked about digital technology.
Thank you.
Well, I agree with you, and search engine optimization is something we pay a lot of attention to, so that when people are searching for information about travel and health, that our site comes up. So I do think that's important. Another thing that we've tried to do is, instead of waiting for people to come to us, to put our information out where people are, and that's one reason our social media has been so important, and not just our social media posts, but promoted posts and advertisements on social media we've seen to be really effective. But I think with our clinician efforts in particular, as we're at the very beginning of that, the recent events have made it more top of mind for people. And I think a lot of health systems in the U.S. are asking about travel in really certain circumstances. And we want to take advantage of that to broaden the conversation. And so we're also looking to history. There was a time when you went to the doctor, nobody asked you about drinking and driving, or nobody asked you about things that would elicit whether or not you're in a domestic violence situation. But those have been added to the conversation. So I'm looking to that process to help guide how we go about it with travel.